If you're coming to Arkansas Children's Hospital for surgery, it may be helpful to know what to expect. Here are 3 things to remember before you get here. 1. A nurse will call and tell your parents or caregivers when you should stop eating and drinking. It's important to follow their instructions carefully. It's something you can do to help your surgery go smoothly. 2. That's the maximum number of people that can come with you on surgery day. They have to be over 18 years old, so no little brothers or sisters. 3. Wear comfortable clothing and bring something to comfort you while you wait, like a stuffed animal or a favorite blanket. You could also bring your favorite book to read or a tablet. Are you ready for a tour? Follow me. Arkansas Children's Hospital is a big place, but there are lots of people happy to help you find your way around. Go through the main entrance in the lobby. The first thing you're looking for are the orange elevators. Ride the orange elevators up to the 2nd floor. Before surgery, you'll be in the waiting room with your parents or caregiver. You might get a sign with your name on it, so you'll have your own spot to sit. Your parents or caregivers will have paperwork to fill out. You can bring something you'll enjoy playing with while you wait. This is where you'll start to meet a lot of people. Everyone specializes in something to help your surgery be the best it can be. Different people take measurements to make sure everything in the hospital is done specifically for you. First, they will see how tall and big you are by measuring your height and weight in a room like this. Afterward, they give you a set of hospital pajamas to wear while you're here. This room is called a pre-op room. Pre-op means before surgery. In the pre-op room, you will meet your nurse, doctor, anesthesiologist, and maybe even a child life specialist. First, the patient care tech will put a blood pressure cuff around your arm and a pulse ox on your finger. Then you'll change into your hospital pajamas and put on a wristband that lets us know important information about you, like your name. The nurse will ask questions about how you've been feeling and your health. The doctor will talk about your surgery, and the anesthesiologist will talk about anesthesia, which is a special medicine to help your body rest and not feel anything during surgery. They're all part of your surgery team. Your parent or caregiver can talk with the nurse or anesthesiologist if you feel nervous. Sometimes the anesthesiologist may give you some medicine to drink to help you relax. An OR nurse will meet you in the pre-op room and ask questions about you before surgery. You get to lay in the bed while the OR nurse pushes it around with your parent or caregiver walking next to you. Your parent or caregiver will say, "See you later," before you go into the surgery room, and will head to the waiting room where you waited earlier. Remember, you can bring your favorite comfort item into the surgery room, like your tablet or stuffed animal. Your parent or caregiver will get messages throughout the surgery to stay updated on how everything is going. This is the operating room. Everyone here helps with their surgery, but not all machines will be used. Once in the operating room, you'll be moved to another bed. There will be bright lights to help the doctors and nurses see. They will put some stickers on you called electrodes that tell us how your heart is doing. You will also get a pulse ox and a blood pressure cuff again. Next, you will get anesthesia medicine. Anesthesia makes sure you don't feel, see, or hear anything during surgery. You will get this through a mask or an IV, depending on what's best for you and your body. If you get an anesthesia mask, this one like cherry, strawberry, or bubblegum. Next thing you know, you'll wake up in another room. This room is called the post-anesthesia care unit, or PACU. There will be a lot of people and machines and noises. Other kids like you, the doctors and the nurses taking care of them too. You get to rest here before someone brings your parent or caregiver to see you. You'll probably still be a little sleepy from the anesthesia. The nurses are nearby if you need anything, and you'll have a button you can press to ask for the help. If you need it, depending on your surgery, you might continue resting in your own post-op room, which is like a pre-op room. You may get a popsicle, a snack, or something to drink before you go home, and you get to change back into your regular clothes. The nurse will send you home with instructions about what to expect when getting home from the hospital. Some kids stay the night at the hospital after their surgery. If admitted, you will go to the inpatient floor from PACU. At least one of your parents or caregivers get to stay with you in the hospital. There are activity rooms you may be able to go, and toys and activities that can be brought to you to play with. Healing happens best in a place you can rest. As soon as you're ready, they'll send you home with instructions for your parents. Arkansas Children's Hospital takes care of hundreds of kids every day, and they'll be happy to take care of you. Their mission is to make you better today and healthier tomorrow.